Hey folks, it's Chuck with Homestead Medical. Today we're going to continue our series of videos on our layers of medical preparedness and what our next layer is going to be. Earlier video we talked about our mindset, training, um, our medical intelligence that we need to so we can decide how we're going to be prepared, and our EDC, what we carry on our body and with us in a bag or something at all times. So now the next layer is going to be what? Well, a lot of times when you're out, what do you have with you? Your vehicle. So we're going to talk about some vehicle med kits, things that we can keep specifically in a vehicle so we're prepared. So my first one, and I actually keep two, this is a special operations equipment vehicle med bag. So a couple things you'll see about this is very distinctive color, red. The reason I have red is that it's in the vehicle. If I'm out of my vehicle and I need somebody to go retrieve the med kit, I can say, go and get the red bag. That way they're not having to look through everything else. This stands out. So on the back, you can see it's got a slip pouch. I've got a SAM splint in here that I can use for splinting and immobilization. Plus, I have some chest seals. So that way I'm prepared for any of those penetrating chest wounds. The other things that you'll notice about this is it's got a strap that you can throw over your shoulder. I've attached a 6x6 pouch by Special Operations Equipment on the front of the Molly to give me a little bit more storage. I've got a tourniquet that's ready to go. It's got one elastic band I can rip off. It's ready to go, quickly accessible. And the way this opens is the clamshell's open. Now, as you can see, you've got many elastic loops, even on the wings here, that you can organize everything. This is primarily set up for trauma, but as you can see, I've got quite a bit of equipment in here. I've got tape, I've got nasopharyngeal airways up top, I've got quick clot, I've got some wound packing gauze, 3 packs of that, a couple of nasopharyngeal airways, 2 chest decompression needles, 2 Israeli bandages, emergency compression bandages. I've got a flat roll of an ACE bandage. In here, I've got vet wrap tape, that elastic tape that helps you can secure a splint and stuff. And then I've got duct tape. In the bottom part, or the other side, I've got an Ola's bandage. I've got a 6-inch Israeli bandage. I've got some regular gauze in the back here. And I've also got some abdominal dressing, so I could take the gauze and stuff for large wounds that I can dress. Plus, I have a chem light here to identify as a marker, things like that, which I have more chem lights on the outside. And then also I've got regular medical tape that's ready to go. Now, this thing has loops and stuff all around it, and you can organize. You can put so much gear in here. But again, this is set up for primarily trauma in my vehicle. Inside here, in this pouch in the front, I've got multiple pairs of gloves to protect myself, protection. I've got an emergency blanket to treat shock. And then I've got a strap cutter, a cord cutter that I can do for anything bigger. Now, I've got multiple ways to cut things, knife on me, like every man should always have. But I also have shears that can also not only cut close so we can expose injuries, but you can cut seatbelt straps, things like that with it. So all this resides in a pretty right behind my seat, so I can grab it and go. And then I've also clipped on some heavy leather gloves. So, because you're going to be dealing with glass and stuff, if you come up on a car wreck, you come up on something, that way you've got this equipment and stuff. It's very easy. This is a small compact thing. It's a great piece of gear. This lives in my vehicle. I'm set up that I could take care of multiple patients in this. And you've noticed probably on some of this, the tape that is on some of these, on the edges where these are supposed to tear. Well, the reason is, and we explained that in another video prepping our equipment, but this is, you're going to have gloves on, your hands could be bloody, things like that on that glove. This gives you a better purchase point. So you're not having, everything's prepped, ready to go, so I can grab it and use it when I'm ready to go to work. So that's one kit. I carry a more extensive kit because you're not always dealing with trauma. That's something, if I roll up on car wreck or something like that, that I can grab that and go and assist people. Or large injuries, big injuries, something I'm out doing, somebody gets hurt, I've got it. It's right there by my car. Remember, that's the layers. My EDC kit was to take care of those emergent things that could kill me in 5 minutes or less. Arterial bleed, large wounds. We have compact pressure dressing, wound packing gauze to stop bleeding. We've got chest seals for penetrating chest wounds, nasopharyngeal airway to protect airway. But those are things that are small and compact that'll take care of things until I can get back to more extensive equipment. The other one I carry is this one, distinctive color, an arid camo. This also resides in my van. It's just a special operations equipment mini pack. Great piece of equipment. It's a little backpack that stays in the back, but it goes in. It has a large zippered pouch in the front, which I keep a large emergency blanket. I keep some baby aspirin that we use for people having chest pain, things like that. Some other meds. I've got a notebook. I've got, yet again, duct tape because it fixes everything. Like I said, I have duct tape and everything. A pair of shears, gloves, a headlamp. And I didn't talk about the headlamp in there, but I have a headlamp in that other kit too. But you want a headlamp, why? Well, you could come up at night and you want your hands free. You want to be able to see what you're doing. Throw that headlamp on. You can illuminate and see everything that you're doing around, and your hands aren't tied up holding a flashlight. I've got another tourniquet in here, so it's readily accessible. And then in here on the inside of this, it's Velcro lined. And what I've done is I've gotten 3 mesh pockets from Special Operations Equipment, 2 small and a large. So this is set up inside here is basically another IFAC, pressure dressings, wound packing gauze, some quick clot hemostatic gauze. I've got a pair of hemostats. And this bottom part is airway that I've got chest seals, nasopharyngeal airways, and I've got another emergency blanket in here to treat shock, to keep our patients warm. And another thing is, got an eye for eye injuries. I've got an oval eye pad, soft pad to put over the eye, plus a shield to protect the eye. Because if we have any type of eye injuries, we want to save that sight, so we want to protect it in every way. The other thing that I have in every single one of these pouches is gloves. Now, I know I said I had gloves in that front pouch, and I do. But I put gloves in every single pouch of every med kit because what if I need to change gloves? They become soiled, too bloody. I need to put another pair of gloves on. Or I'm going to treat another patient. Obviously, I don't want to bring somebody else's blood to that, so I have that. Plus, if I just, in the heat of the moment, forget to put them on as I open this pouch up to get equipment, I've got gloves. So on the other side of the pack, and I failed to mention, in this, there is a back pocket behind the Velcro that goes all the way down. This one, I've got another SAM splint. So this large pocket, this is one of the large mesh pockets from Special Operations Equipment. It's just a little bit of everything. There's 4x4s, 2x2s, Band-Aids, gauze, a lot of different gauze. I've got some meds and stuff in here, and I keep this little pouch in here that's got basically boo-boo kit, Band-Aids, things like that, some over-the-counter meds like that. And the other thing that I keep in here is a blood pressure cuff and stethoscope. So that way I can evaluate somebody if they're sick. In the front pouch here, I've got a pulse oximeter so I can see what their oxygen levels here. But in here has everything from splinting materials to any type of little emergency. I've got more chem lights in here for markers and stuff. And then in this pouch in the back, I've got an airway kit. So I've got an ambu bag, which is in here. And what that is for is those big balloon things you see as they squeeze, puts the air in, and has a mask and stuff on. But what I also have is a more extensive airway kit, and I've got what's called a King airway. So what this is for, our nasopharyngeal airways are something we use to protect somebody's airway if they're unconscious, unresponsive. The King airway we use if somebody is not breathing. All these things you'll learn in my classes, and you'll learn how to use this equipment. But this just gives you an idea of how to set up some more kits and more layers of protection. So it's just to be prepared and have all your equipment ready to go for when that emergency arises. So I hope this brought some value to you. If it does, please share, like, subscribe. Share this out to somebody if you think it brings value and bring you the training you need so you are confidently prepared for any emergency that comes out. I'll talk to you soon. Thanks.